First aid for strains. Elevate a straight leg muscle on a pillow. You can prop your leg up on a pillow while you are lying in a bed or sitting on a couch, for instance. Elevating the muscle as much possible will help prevent and reduce swelling. Apply heat for 15 to 30 minutes every 2 to 3 hours to increase blood flow to the injury. Heat will help improve the circulation to the strained muscle. If you have a hot water bottle, hold it against the strain for about 15 to 30 minutes at several times a day. If you don't have a hot water, you can use a disposable heat wrap or a heating pad. Treating an open fracture during first aid. Call for emergency services immediately. Ask the injured person how he was injured. If you didn't see the accident happen, you'll want to get a quick history from the person as soon as possible. Determine where the open wound is and if bone is protruding from the skin. Do not remove any foreign object penetrating the body. A penetrating wound may have first an artery. If you remove the object, the artery may begin to bleed profusely and the person may quickly bleed out and die. While waiting for the emergency help, determine if there are other life-threatening injuries to the body. First aid in treating minor wounds. Apply pressure to the wound to stop the bleeding. Wash your hands, then use a clean bandage or cloth to press firmly on the wound. Washing your hands will prevent you from transferring bacteria from your hands to the wound. The pressure will help slow the bleeding and promote clotting. Clean the wound. Rinse it with clean water. This will help to remove dirt and other particles that can cause infection. Wash the skin around the wound with soap with a clean washcloth. Gently pat the wound and surrounding tissue dry. Prevent infection with a topical antibiotic. After you have stopped the bleeding and cleaned the wound, apply an antibiotic cream to protect it from infection. Cover the wound with bandage. This will prevent bacteria and dirt from entering the wound, depending upon where the wound is located. A simple adhesive bandage will be sufficient. If the wound is larger or located near a joint, you may need to wrap it so the covering will stay in place. If you have a serious wound, you must call for emergency help.